Good evening and welcome to the Cure HHT webinar series. I am Nicole Schaefer, Director of Professional and Medical Programs for Cure HHT. Thank you for joining tonight's webinar, Managing Stress and Emotional Hurdles in HHT. Before we start, I want to let you know that tonight's webinar will be recorded and available on the Cure HHT website in the resource library for future reference or to share with your family members. We have muted everyone's phones or microphones to eliminate background noise. You have several options tonight on your control panel. You can change the size of the shared screen. You can download 5 handouts relevant to tonight's webinar. These handouts will also be available on the recorded version that's posted on our website. And you can type your questions throughout the webinar. I will ask as many questions as time allows. Please remember to ask general questions related to tonight's topic so the answers will benefit everyone on the call. And after the webinar, you will receive an email with a short survey. Your input is critical to the development of future webinars, so we appreciate you taking a few minutes to complete this for us. Before we begin, I would like to introduce tonight's speaker. Dr. Abbey Hughes is a board-certified rehabilitation psychologist and assistant professor in the Department of Physical Medicine and Rehabilitation at the Johns Hopkins University School of Medicine. She earned her PhD in clinical psychology from the University of Kansas and completed a 2-year postdoctoral fellowship in multiple sclerosis rehabilitation research at the University of Washington and VA MS Center of Excellence in Seattle. As a psychologist, she partners with people with chronic health conditions and disabilities to improve symptom management and maximize quality of life. I now pass tonight's program over to Dr. Abbey Hughes.
Thank you, Nicole, and welcome everyone. Thank you for taking the time to be here this evening, and thank you for the nice welcome. The title of tonight's talk is Managing Stress and Emotional Hurdles in HHT. And as Nicole mentioned, my background, while predominantly in multiple sclerosis, MS is also a chronic health condition that is highly unpredictable. There are some genetic components to the disease. And as more of a general rehabilitation psychologist, I work with a wide variety of individuals and families who are navigating the uncertainty of living with a chronic health condition. So some of these themes tonight, which will be very specific to HHT, other things may be more general. I certainly welcome all kinds of questions, and at the end, hopefully we'll have some time to go over all of your questions. So before we begin, I want to speak about the elephant in the room, right? So we could have a talk about emotional hurdles in HHT, but during the time now, especially with COVID-19 happening, everything about your medical care may be shifting, right? And the level of uncertainty and unpredictability of managing a chronic illness is elevated for a lot of people with disabilities and chronic health conditions. So as we go through tonight's talk, while some of it, again, may be more general, I also want to make it specific to managing the stress associated with COVID-19. With a caveat being, I'm not an expert in COVID-19, but this is something that's coming up repeatedly in most of the individuals that I work with, and I can imagine it may be something on everyone's minds right now. The overview of tonight's talk is first we're going to begin by talking about some common HHT stressors. We'll talk about the emotional impact of these stressors, and then we'll move into talking about strategies for managing that stress, and finally ending with a Q&A. Before we begin, we have a polling question for you to take, and you'll see a question box pop up on your screen shortly. Try to answer that question. It may look slightly different than the options you have on your screen because we have some limited ability in the number of choices, but you have a box in front of you that says select one or more of the following. Go ahead and select the one that applies to you. We'll wait about 10, 15 seconds, and then we'll close the poll so that we can look at our results. I'm looking for the polling results and they are not popping up for me. However, if Nicole, if you're able to see them, if you're able to read off what the results were, that would be very helpful.
Yes, so it says that 88% have HHT, 48% have a child with HHT, 44% a parent with HHT, 40% a sibling with HHT, and 48% have another family member with HHT.
Okay, thank you. Again, we're always learning about these technological changes depending on the question that's asked. All right.
So we
now
now
there's a second question that's now popping up. You can go ahead and answer this one now. There may be a second set of options that you can select if you're a caregiver of someone with HHT or a healthcare provider, or if you're just here to learn more.
And so in this case, 23% are a caregiver, no one is a healthcare provider, and 77% are here to learn more about HHT.
Okay, wonderful. Well, as we'll talk about later in the discussion, one of the best ways for coping with a chronic unpredictable illness is try to learn as much as we can in order to prepare. And so by being here, you're already doing a phenomenal job just trying to gather more information and learn more about the condition. So some of you may already be familiar with living with HHT and what the stressors are that come out of this. But just to go through the list here, because of its chronicity or it being a chronic condition, that makes it inherently a more stressful condition than maybe something that's more acute or time limited. It's also highly unpredictable in terms of nosebleeds and other symptoms that may come on very suddenly, and you may have periods where you have more symptoms or less symptoms. That variability can be one of the most burdensome aspects of this illness. Family HHT status. Most of you mentioned not only yourself having HHT, but also a family member with the condition. And those dynamics of yourself and working with family members can be additive and stressful. Access to treatment and testing. If you've personally been through the testing process and remember what that was like, getting access and getting insurance coverage can often be a stressor. And just the idea of future planning. We don't know what the future holds, particularly now in COVID-19. What's healthcare going to look like? What is disease management going to look like? All of these are sources of stress for people with HHT. We know that some of the stressors are also related to just what makes HHT the diagnosis that it is. As you see on your screen here, the diagnostic criteria are that you have recurrent spontaneous nosebleeds that can range from mild to severe, that there's the small widened blood vessels on the skin and internal organs, and so there's visible and invisible ones. There's the risk of AVMs or arteriovenous malformations. This is an abnormal tangle of blood vessels that increases risk for complications such as stroke. And then there's the family history piece. Each one of these diagnostic issues can also be a stressor. Let's go through some of these. With the chronicity, with it being lifelong and with there not being a cure, that's a huge source of stress for individuals affected by the illness. We talked about this being an unpredictable and variable disease, and then you throw in something like COVID-19, and that increases the level of unpredictability. We also know that each person is different. Even if you have family members who have it, their presentation may look very different than your own. We know that those symptoms can be disruptive to daily functioning, particularly with nosebleeds and fatigue and shortness of breath. One of the complications with COVID is that shortness of breath is also a symptom of COVID. And so for anyone living with a chronic health condition that causes shortness of breath, there's an increased attention to those kinds of symptoms right now. And then we know of these complications as well, such as stroke, brain abscess, anemia, low blood oxygen levels that can affect brain functioning. And there's increased risk for seizures and liver or heart failure. Your family HHT status, depending on whether that's known or unknown, is another source of stress. And then getting through the testing process can also be a stressor. As I mentioned before, access to testing or treatment, finding treatment. Fortunately, there are HHT Centers of Excellence that are highly organized and highly competent experts who can help you navigate the treatment process. But again, getting access or finding those centers can be a challenge, especially if you don't live close to one. And in terms of future planning, as we said before, this can include healthcare decisions, financial planning, family planning, whether to become pregnant, for example, parenting issues, and employment, right? So if you're thinking of retiring, potentially related to disability or related to your health condition, that's an issue with regard to future planning that can be a stressor. So now that we've gone through a very long list of potential HHT stressors, I'd like you to select what your top current HHT-related stressors are.
So our responses there are 90% felt unpredictability of symptoms, 34% their recent medical events or complications, 28% access to testing or treatment, 17% to finances, and 45% the impact of COVID-19.
Okay. So we see a pretty wide distribution that at any given point, any number of these stressors are pretty common in this group. But with 90% of you saying that it's the unpredictability of the symptoms that can be most challenging. So now we can talk about the emotional impact, right? Sometimes when there's a physical or genetic health condition, so much of the focus is on the physical symptom management, right? The management of the nosebleeds, or sometimes pain, or sometimes the other physical complications that come from the disease. But there's also an emotional impact, and this emotional impact can change over the course of the lifespan. So we'll talk about various adjustment points across the lifespan and different aspects of emotional health, particularly how HHT may affect the brain, and therefore how that affects emotional functioning. With HHT, there are adjustment points across the lifespan. This can happen at the initial diagnosis. So again, you may have had many nosebleeds that went unexplained for years, and then when you were finally evaluated or tested, then that was something that you learned that now this is an incurable disease that will be with you for the rest of your life. That's a big stressor, a big change. And depending on when that occurs in your life, again, for children, it could look very different than if you're an adult, right? And if you're a parent and you're trying to share that diagnosis with your child and make sense of it, that's another, that can be a very emotionally laden experience. There's also sudden changes that happen over the course of the lifespan, right? So you might go through periods of stability and then also periods of more hospitalizations or procedures. There's also chronic changes in disability. So over time, people may choose to leave the workforce because of their symptoms becoming more severe. And those decisions can definitely be an adjustment. The decision whether to tell family, friends, schoolmates, or coworkers about the disease, all of these are just decision points along the lifespan, right? Every time you meet someone new or foster a new relationship, you have a very personal decision of if and when to tell that person and what may come with disclosing, right? And that's not to say that there's something shameful or stigmatizing about living with the condition, but it's your personal choice of how to share that information and what that person may do with that information. So there's a certain amount of trust anytime we're disclosing personal information about ourselves, including a medical diagnosis. And then we can talk about major life events that would be an emotional impact for anyone, but particularly in the context of managing a chronic health condition, right? If you graduate from school and you move across the country, all of these things about finding a new healthcare agent, right, or a new agency, finding a new doctor, all of these can be stressful, including pregnancy and family planning, or sickness or death of a family member, particularly if it's due to HHT. HHT can affect the brain, as we said before, by its risk of stroke and brain abscess. There can also be headaches, seizures, and anemia. And when there's low blood oxygen level, that does affect brain functioning, right? So if you have severe fatigue from HHT, that could be due to the low blood oxygen levels, which again also affects your brain, right? Our brain needs oxygen to think and to have adequate memory functioning, to encode new memories, to sleep well. So our thoughts, emotions, mood, and behaviors can all be affected by HHT in that capacity. There's also a completely normal emotional response and reaction to all of these stressors. Up to this point, I've been talking about stress as if it's this abnormal thing. But stress is part of life, right? Stress is something that we all experience from time to time, and to have emotional reactions to that stressor is completely normal. Sometimes people feel that when they experience anger or confusion or uncertainty or worry, that it may mean that there's something wrong with them, or that they shouldn't be feeling that way. And one thing I want to emphasize tonight is that these are all completely normal reactions that can be related and unrelated to HHT. It's when these symptoms start to become so severe that they begin to interfere with your daily functioning, that's when they may become a problem. And then you might want to think about some other management or other helpful strategies, or potentially getting a healthcare agent involved. So again, if these emotions start to interfere with daily functioning, this can lead to symptoms of, for example, depression or anxiety. There's also the concept that life-threatening HHT events can also lead to PTSD, particularly if you had a very traumatic hospitalization experience. When people have shortness of breath or they have acute respiratory distress in the hospital, that can be a very acute stress event that later down the line could cause PTSD. We're seeing a lot of this in COVID-19 right now, in that while it's not been long enough for people to meet criteria for PTSD, the stress of being in the hospital is significant, and we are planning for that. So again, there's many different causes for why you could have a very completely normal, healthy emotional reaction to these challenges and have them become more severe over time as well. The other thing to keep in mind is that HHT affects everyone, right? It affects the whole family system, or the social system, not just the individual who has the condition, but their family members, particularly if their family members also have the condition, their extended family, their close friends, and then their extended social network. Let's do a quick self-check. This is a very simple questionnaire that you have probably been asked these questions before in your primary care doctor's appointment, but it's a good screening test for understanding if there's certain types of emotional symptoms that are interfering with your functioning and becoming problematic. So these 4 questions have to deal with symptoms of depression and anxiety. So go ahead and read these questions to yourself, beginning with little interest or pleasure in doing things. And over the past 2 weeks, how often have you experienced those symptoms? If you experience them never, you give yourself 0. Several days, give yourself 1. More than half the days, give yourself 2. Nearly every day, give yourself 3. And if you answer all 4 of those questions and your score is more than 4, so if your total score is more than 4, it may be indicative that you have some more significant emotional health needs, and that talking to a psychologist or a mental health provider may be the next step for you. We'll also talk about some self-management activities you can use to manage these uncomfortable and difficult emotions. Most of us have a very wide range of different kinds of coping strategies. So when we talk about emotional health, we don't always have to jump to going to see a psychologist or a mental health professional. All of us are equipped with various types of coping strategies, and some of them are more helpful than others. So I want to draw your attention to some examples of some potential coping strategies, because these are things that you can use in the context of HHT. And it's also important to think about what are some coping strategies you might be using right now, particularly in the context of COVID, that may be more or less helpful than prior to COVID. So the first and third bullet points are bolded in green, and they're bolded in green because in general, these are considered adaptive or helpful coping strategies. The second bullet point, emotion-focused coping, it's orange because emotion-focused coping can be positive or negative or somewhere in between depending on how you're using it. It's not a consistent one that's helpful. And then avoidance, the one that is bolded in red, tends to be a very unhelpful coping strategy unless you're in a very acute period where avoidance is the only way to survive in that moment, and then you come back to it later. So let's start with the green ones, action-focused coping and acceptance. These can include things like problem solving and planning, or trying to change your perspective when you're faced with a stressor, right? A lot of us do these things naturally. People who are higher in levels of optimism, for example, tend to use these strategies pretty almost automatically. With emotion-focused coping, this is something that's in the orange bullet. Venting is a good example of this, right? We all love to vent. Venting can be so cathartic when you've had a bad day and you just need to vent it all out to someone that you care about. There can definitely be a function for that, and it can be helpful. But if you get into venting too much or too frequently, you can get really caught up in it, and it's hard to see that there's any other strategies to use. And over time, it can generally not be as helpful of a strategy. So in our next poll, I want you to select what are your top helpful ways of coping. Again, the question you're seeing is probably a little different than the one on the slide, but go ahead and select the ones that are most helpful for you.
So in this poll, we have 63% stating learning about HHT, like webinars and asking questions, 59% planning for their symptoms, 59% getting or staying physically active, and 59% getting or staying socially engaged.
Wonderful. So all of you are already identifying some really helpful ways of coping. Notice that I asked about the helpful ways of coping. There's another question that's popping up on your screen now to select some additional top helpful ways. So go ahead and select two again that may be additional ways of helpfully coping with HHT.
So in this case, we have 40% said challenging, unhelpful, catastrophic thoughts, 60% talking to an empathetic friend or family member, 20% seeing a counselor or mental health provider, and 77% practicing resilience, finding positives in a challenging situation.
I love that. So again, even by all of you being here tonight, you're practicing not only trying to learn more about the condition, but practicing resilience and finding the positives in the challenging situations. We'll talk more about that as we continue. So when we think about emotional health, there's not a direct link between HHT stress and poor emotional health. Up to this point, it's probably sounded like that's the connection I was making because we talked about all the things that can cause stress in HHT. But there's something really important that happens in the middle point between these. And this is the part where people can have much more management and more efficacy in managing their symptoms. HHT stress can often cause people to become disengaged. This is the avoidance coping strategy, right? That you're fatigued, you don't necessarily want to go out, you might feel depressed or a little down. And over time, if there's too much disengagement, right, avoidance of social activities or connecting with others, avoiding activities that would normally be pleasant for you, for example, pleasant activities are a really important thing for mood management. That disengagement is what causes the poor emotional health. So it's not just the presence of the stress, it's what you do with the stress that then can lead to the outcomes. And again, that's where psychologists can come in, that's where you can come in, that's where family members and social supports can come in, because they can help you with that disengagement part. So we've talked and hinted at some of these management strategies, many of you which are already using them very effectively, which is fabulous. But we'll go through a list of these self-management tools, what kinds of social support might be most helpful, how your healthcare team can be involved in that, and also how to find a psychologist, particularly a special kind of psychologist, such as a rehabilitation or a health psychologist. This will be our final polling question of the session this evening, but go ahead and answer this question for you about your experience with mental health providers. I suppose an additional question would be to ask if anyone in the audience is a mental health provider, but we will keep that in mind for the next one.
So in this poll, we have 21% have met with a mental health provider about HHT. 31% have met with a mental health provider, but not about HHT. 24% have never met with a mental health provider, but would like to. And 24% have never met with a mental health provider and do not wish to.
Okay. So that distribution is often what I hear when I give more public talks like this, right? So there's people who vary, right? There's some who have had the experience and they may want that experience again. There's some who've never had the experience and don't feel like they need to. And again, depending on your individual situation and your self-management goals, you may or may not benefit. One thing I like to put in there is that most people can benefit from setting goals and working toward those goals. Right? That's how we build confidence and self-efficacy. But you may or may not need a psychologist or a mental health provider to help you do that. So let's talk about self-management strategies. We talked about learning about HHT. This includes, staying up to date on the public announcements that come out from organizations like the Foundation, but also staying up on the scientific literature. If you yourself are in the healthcare field or a science field and you have access to scientific publications, doing a search every now and then to see what the latest research is. When I did a search of, for example, PTSD in HHT, that was a relatively recent article that came up. It's also important to monitor your emotional symptoms using a screener like the one that I showed. Now, that's a pretty general screener. You may find ways of monitoring your emotional symptoms that might be easier for you. Sometimes people have an app. Sometimes they journal, and they look at their journal and they think, well, I was kind of writing about feeling down the other day. Maybe I want to keep track of that and see if there's a theme. And if my journal entries kind of keep looking down, that may be something I want to address. Communicating directly and honestly. This can be a challenge for all of us, right? When we're feeling fatigued, when we're feeling sad, when we're having challenges, that direct communication is so critical, especially with your healthcare team. So being honest about the symptoms you're experiencing, perhaps the fears you're experiencing, and troubleshooting how to cope with those. You might also want to explore your HHT identity, right? So when someone is diagnosed with a chronic health condition, particularly one that doesn't have a cure, that may become part of your identity. And that doesn't have to be a bad thing, right? It is neither good or bad. In fact, it's a really important thing to consider. Where does HHT fit into your identity? Setting SMART goals, and we'll talk about SMART goals in a minute. Again, building self-efficacy, building confidence, and finding benefits, which over 70% of you said you already do, which is fabulous. These self-management strategies are especially important, again, during a stressor like COVID, right? We're all being challenged to cope with stressors in different ways, right? We may be at home more. We may not be able to go to our doctor the way that we normally would. And so monitoring those emotional symptoms from week to week, you may find yourself having more heightened emotional distress now, and that would not be uncommon. You can learn about HHT again through the HHT website and through the HHT Centers of Excellence. Many of you are probably already connected to. You can also learn a lot through participation in research, right? With this being an incurable disease, the only way to find a cure is to do research. Same way that people trying to find a vaccine for COVID right now are working round the clock to do that. And the people who are participating in research are learning more about the process. Sometimes being a participant in research can get you access to experimental treatments, different opportunities, different ways of connecting with others with HHT that you may not have had otherwise. And it's a really great opportunity to then kind of pay it forward and contribute to the science so that we can learn more and actually work toward a cure. If you are interested in finding the scientific articles and you have access to a university library, things like Google Scholar or PubMed searches are a good way to go. In terms of your emotional symptoms, as I said before, doing a regular check-in with yourself, maybe even once a day, setting a timer to check in and kind of see how you're feeling. Asking those closest to you if they've noticed a change. Sometimes when we become really irritable, we may feel off, we may feel anxious, we may just feel like we don't want to be around others. But if someone asks how you're doing, you might say, I'm fine. So asking someone you trust to say, hey, have you noticed anything different about my behavior? Does it seem like I'm on edge? Am I snapping more? They can give you that feedback, and hopefully you're in a place where you're open to hearing that, because this can be a partner in your care as you look toward coping with the symptoms. You also want to consider the role of fatigue and your other HH symptoms in your emotions, right? So when you're fatigued, you may feel more vulnerable to sadness or depression. You may feel less motivated to get out and enjoy things, with your family or with the close people who you're quarantining with right now. With the communicating directly and honestly, sometimes identifying the primary goal or the outcome of what you want to achieve, whether it's a medical appointment, whether it's a difficult conversation with your child and talking about HHT, or a parent, using I statements like I feel X or I'm concerned about Y. Those can help bring the focus to you and your experience, as opposed to pushing it on blame of you're not doing X or you did that and it made me feel Y. So those I statements can be really helpful. And then also expressing empathy for others' feelings and perspectives, which can be really challenging when we're stressed, when we're having our own emotional symptoms. It's really hard to take that perspective of someone else's feelings. I mentioned exploring your HHT identity. HHT is part of you, right? Some days it may feel like a larger or smaller part, and that's okay to have that variability. But making room for it allows you to participate more fully in other aspects of your identity. Sometimes people feel like they have to live as if they don't have the condition, and they push it away and they push it away. And then when they have a medical event, it comes flooding back in. So making room for that so that you're checking in with that aspect of your identity on a pretty regular basis can be really helpful for managing. Setting SMART goals. Some of you may already be familiar with this acronym, but it stands for specific, measurable, achievable, realistic, and time-based. These are the kinds of goals that are most likely to be achieved, right? So it's not just that I want to exercise more. It's not just that I want to learn a new skill during the COVID pandemic. It's I want to spend 1 hour per week practicing my guitar that I haven't taken out of my closet for years. Notice in that kind of example, I set a specific time, duration, what exactly I was going to do. So not just picking up a new hobby, but what hobby am I going to pick up? And again, this works not just for management of your disease, but really any kind of goal you want to achieve in life. But when it comes to HHT, something like I'm going to take 3 15-minute breaks throughout the day to manage my fatigue at work. That can be a great SMART goal strategy that you set a timer. You see that it's specific, you see that it's time-based, you can measure whether you were successful with the goal or not. And depending on how realistic this is for your work, you may answer the realistic part, yes or no. Or something like, I'm going to contact my HR office next Monday to inquire about short-term and long-term disability options. This would be one of those planning examples, right? That you may not need the disability options right now, but you might want to learn more about it. So you can set a goal to gather more information and when you would gather that information. The key thing about SMART goals is that they prevent emotional burnout. It helps with planning, anticipating your support needs. It allows you to use healthy coping strategies like these active or acceptance-based strategies. It also helps you make different adjustments in your lifestyle behaviors, right? When we set a SMART goal, we're usually changing our behavior in some way. We're either starting something new, or either maybe starting or decreasing something that was maybe harmful for us, like smoking, or adjusting these lifestyle behaviors. And then importantly, there's the aspect of benefit finding. Sometimes if you sit back and think, if I could take away the HHT in a heartbeat, I would. But since I can't, what are some of the benefits that have come out of me living with this, right? Have I learned to appreciate things differently? Have I become closer with some family members because of that shared experience? Are there other opportunities for connection, like even participants on this call, other ways of joining support networks or peer support groups? Those are all different opportunities or benefits that could come out of living with it, even though it is a very stressful condition. When it comes to social support, it's really important to think about who in your support network is an actual support. Just having a friend doesn't necessarily mean that they are a social support person for you, and that's similarly for family members as well. I think we all have different people in our lives, some of whom can be more or less helpful when we're facing a stressor. So I always like to use this example of finding listeners, not fixers. I don't know if anyone else has people in their life, or maybe you are one of these people, that when you see a problem, you really want to take charge and you fix it. And sometimes you're effective in that, other times you're not. So some of these examples you can hear come out, that the fix-it mentality often comes in when someone says, can you just X? Or why don't you just X? It can be really invalidating to hear that. It can make it seem like the problem is a very simple fix and that you're just working, that there's something else maybe wrong with you of why you didn't just decide to fix your problem. And so I generally, when I'm working with individuals living with chronic health conditions and their family members, we talk about these kinds of phrases. What are some of the phrases that are the listeners? What are some of the kind of phrases that are the fixers? And how can you work on some of those statements? Again, the one highlighted in orange is a hybrid, right? It's not totally in the green, but it's not quite as unhelpful as the red. So you might hear this in a support group, or when you're with other people with HHT, they might say, try this, it worked for me. And that could be a medication, it could be a diet, it could be any number of different things. Or here, let me do this for you, I'll do X. The idea being that they see that you're stressed, they may see that you're fatigued, and they want to go do something for you. Again, very well-intentioned, almost 100% of the time, these things are very well-intentioned. But they can have the effect of making you feel less confident, less successful, less efficacious. So some other potential ways of communicating could be, this sounds so hard. What would you like from me? These are open-ended questions that express understanding, that allow you to learn more about the person and their individual experiences. And again, these strategies aren't just specific to HHT, but it can be a really helpful reminder when we're in a period of high stress. Sometimes these strategies go out the window because we're being reactive. So this allows us to kind of come back and remind ourselves, you know, I think I was a fixer the other day. In fact, I know I was. How can I think about that the next time a similar situation comes up? And again, you can use this with family, friends, peers, etc. Another management strategy also involves your healthcare team. So now we're moving outside of the self-management and moving more to the multidisciplinary management, right? There's not just a single doctor that you're going to see. You probably need multiple specialists to manage the various symptoms. An HHT Center of Excellence is certainly a great place to start, and you can find that on the website. But you could also work on forming your own healthcare team, right? You may have a specialist who you really connected with, but they're on the other side of the city from you, or the other side of the county. The key is it doesn't really matter who you go to for care as long as they know what they're doing and they're coordinating with your other care members. So the 3 C's are communication, coordination, cooperation, and you're at the hub of that, right? You're at the hub of managing these various healthcare providers and holding them accountable for connecting with one another, right? Again, these directors and navigators, they are available to help you. Asking about telemedicine can be a huge benefit right now, particularly during the COVID crisis. Almost all centers across different states and across different insurance policies are now covering telemedicine. We don't know what that's going to look like when COVID-19 starts to morph and we start to move out of that, maybe whatever that's going to look like. We really don't know what that's going to look like. But we do know that right now, telemedicine is probably more accessible today than it ever has been. And we want to advocate and make sure that that continues to be the case. So if you're an individual who's on an advocacy board or an advisory board, if you have an opportunity for lobbying for healthcare, this is something that's going to be really critical for people with disabilities and chronic health conditions, particularly if a physical exam for an appointment isn't necessary, right? You can often do a check-in via video visit. And that brings me to psychology. You could consider meeting with a rehab or health psychologist, and you don't have to have a 5-year commitment to meeting with this person. People may benefit from a single session. Working with a rehab psychologist or a health psychologist, this is someone who specializes in working with people with disabilities and chronic unpredictable health conditions like HHT. We can help. So I am a rehab psychologist. I help and work with individuals who have depression, anxiety, or emotional reactions to HHT or other comorbid health conditions. Because again, it may not just be HHT that you're living with. It could be any number of other health conditions as well. We can also help with the adjustment to a new diagnosis, and that includes both yourself and your family members. Most people don't realize that if you have an appointment with a psychologist, you can include your family in that, and that can be part of your treatment goal. It's really hard to be successful in treatment in a disease or in a condition that affects the whole system if you don't have multiple individuals in that system who are participating. Coping with HHT symptoms and uncertainty. There's some emerging research that specifically targets this uncertainty, right? When we feel uncertain, we feel like we lack control. We feel like we start to develop these catastrophic thoughts, and working with a psychologist or a mental health provider can help to shift some of those catastrophic thoughts and make them more realistic. And again, coming back to setting and maintaining those self-management goals. Sometimes just having a single session with a health psychologist can help realign those goals and figure out where your priorities are. You might have a list of 30 things that you want to do, but you're not going to be able to get any of those things done unless you prioritize what the most important thing is and how to do it. And just having that third-party person listen to you, your values, your context can help with that prioritization. So if you're interested in learning more about rehab psychology, the Division for Rehab Psychology is available on the link on this slide, or you could just Google Rehabilitation Psychology and learn a little bit more about it. So I'll go ahead and stop there so that we have time for questions at the end. But again, I really want to thank you for your time this evening. I know I went through a lot of those strategies fairly quickly, but that was also so that we can have some time for discussion. I've included some references here. Most of the information taken from today's talk came from these specific research resources, as well as the workbook Living with HHT by Dr. Sarah Palmer. She's also a rehab psychologist with Johns Hopkins, and her workbook is really the book for management of HHT. So with that, I think we will shift to some Q&A.
Great. Thank you so much, Dr. Hughes, for such a wide variety of ways we can start to manage stress and the emotional hurdles related to HHT and just life in general. So we really appreciate your insight. And we do have some questions this evening. Our first question is, how do you recommend sharing your HHT diagnosis with an employer or your child's school?
That's a great question. And it depends on a few factors of how much the symptoms are interfering potentially with your functioning or your child's functioning in those environments. And also how much you trust the people in your work or your school environment. Transparency and disclosure can be a very meaningful discussion. And importantly, it's not just a single discussion. You can think about it in terms of opening up the discussion to say, the first goal is that I want you to know this about me. The second goal is I want to provide you with some information so that you can understand my worldview, right? Understand why I have certain challenges that I may have. Particularly for working, if fatigue is an issue throughout the workday, you may want to build in some time in your schedule for management of that fatigue. And that could mean taking breaks. And that could mean having to request accommodations, which you have every right to do through the Americans with Disabilities Act. So in terms of when you think about approaching that conversation, the first thing you might think of is, who is the individual you most trust to take that information to? And how would you like to start that conversation? If you're starting it, you're more in the driver's seat, and you can start to think about what features you want to bring in. You may want to prepare for lots of different kinds of questions, and then also knowing that you may not have all the answers, nor do you have to provide all the answers. You don't have to put the burden on yourself to be the expert in HHT and provide all of that information. You can also direct someone to resources like Cure HHT. The important thing to keep in mind is what is the reason for disclosing. Oftentimes people want to jump to help, but they don't necessarily know why it is that you would be disclosing and what would be helpful for you. So thinking about that ahead of time is a nice way of structuring what you want to get out of the conversation.
Fantastic, thank you. I have someone asking, is HHT considered a disability? You mentioned the Disabilities Act.
Great question. Any chronic health condition, any condition at all that interferes with some kind of functioning can be considered a disability. So disability is defined in several different ways. There's a general term for disability that falls under the ADA, right? So this is something that interferes with your ability to perform a certain task or symptoms. For example, symptoms of HHT could contribute to physical disability or fatigue that interferes with, for example, employment functioning. Then there's a separate definition of disability that often comes in the case of applying for Social Security disability. And so that's where I strongly recommend that if you are considering applying for SSDI, Social Security disability, to find an attorney who specializes in those kinds of applications. Almost everyone gets denied the first time around for any number of reasons, largely because navigating government paperwork is really challenging. And so having an expert who can help navigate that process can be really helpful. So again, when you ask, is it a disability, it kind of depends on what impact it has on your functioning.
Great, thank you. I have, relating to children, I have a question asking if there's a site that parents can use to talk to other parents about coping, with issues that your children might have.
Such a great question. And I would probably defer to the Cure HHT organization for helping connect people with one another and finding, for example, support groups, right? Parenting and decisions around parenting, particularly for school-age children. There's a million questions that can come up about health status and managing nosebleeds and helping connect other kids with one another and connecting parents with one another. You might be able to find some Facebook groups. Again, we're in a very virtual world right now, given that very few of us are interacting in person. So now may be the time to actually find these support groups. And you may find that some support groups that used to meet in person are now meeting online. So I will defer to Nicole for providing any additional resources for specifically connecting with other parents. I imagine a comprehensive center of excellence may also have these resources, so you could call the center closest to you and see if they have a support group or ways of connecting with others.
Yes, so there is an HHT Facebook group called Raising Children with HHT, and so that is specifically for parents with children with HHT. I do also recommend the HHT Centers of Excellence just to see if they do have any kind of support mechanisms there as well. So the next question is, how do you recommend sharing your diagnosis with a new partner or like when you're dating?
Great question. So again, a lot of questions around disclosure of who to tell and when to tell. It's a very personal process, right? Some people find that they're really an open book in terms of they can say their favorite color the same way that they can talk about their medical history, and there's a comfort level with that. So thinking about if you are in a new relationship and you are dating, what would you want that person to know about you at what stage of your relationship, and what kind of control do you want to have over that, right? So particularly when it comes to nosebleeds and having them be pretty, if they are severe and unpredictable for you, would you want to be able to tell your partner or the person you're dating before you had your first event with them and have that be the incident where you're not only managing the nosebleed, but then also talking about the condition with them and saying, no, it's okay, like I'm managing it. So thinking about that, thinking about, when you're dating, is this someone who you are looking forward to having a long-term relationship with? Or is this, someone that you're just kind of trying out? If it's someone who's more long-term, having that conversation earlier, again, providing information about the condition, directing them to learn more about the condition, it can also be a way of testing your communication with one another about the condition, because it's part of you, and if you stay together, it's going to be part of your relationship together. And if things continue to progress and you were in a position where you had biological children together, then your children may also have that risk factor. So ensuring that the person that you're with understands that piece of it and has an opportunity to ask questions. And again, going back to the idea that you don't have to be the expert. You can provide materials, you can provide links, you can talk about your individual experience, but also noting that it's a highly variable condition. So you don't have to take on the full burden of being that informer, and you can communicate that to your partner as well. If you're in a position where they're asking all kinds of questions and all of your dates start to feel like a Q&A, you can say, this is part of me, but it's not all of me. And I get that you're curious. I'd love to talk about it some more, but can we put a pin in that for now? Here's some resources. Maybe go watch a YouTube video about it, and then we can come and talk about it more. Right now, I just want to go have dinner, right? I want to go to a movie. I want to talk about the movie. I don't want to be completely surrounded by just this topic.
Great, thank you.
Mm-hmm.
So we have a question. They're asking, what are the characteristics of PTSD?
Great question. So symptoms of PTSD, the number one criteria is that you had to have had experienced a life-threatening event or perceived to have experienced a life-threatening event. So having had this period of fear where you felt your life was at risk, or that you experienced a threat to your safety. And then there's usually a gap period of time, around 3 months or so, that if you're still experiencing symptoms after that 3-month period, that's one of the criteria. Those symptoms can include things like thinking very frequently about the event that happens, having really intrusive thoughts. It can include things like flashbacks, so and feeling like you're actually back in that moment. And again, depending on the severity of the event, some people have never had a flashback, other people have flashbacks regularly. So you don't have to have a flashback just to be diagnosed with it. There's also a pattern of avoidance of anything that reminds you of the event that happened. So for example, if you almost died in the hospital and or your child almost died in the hospital, going to hospitals may be a very triggering event for you. And it's probably something that doesn't happen all that often. So every time you do have to go into the medical environment, it increases your anxiety and reactivity to it. You also may just feel more physiologically reactive. So feeling like you have your heart racing more frequently, feeling like you can't calm down. Insomnia is a big feature of that. So I want to put the caveat here that I'm not an expert in PTSD, but in terms of these are some of the symptoms that people who are recovering from an acute or a traumatic event who are still experiencing these symptoms, and if those symptoms are, again, intruding on your daily functioning, that's when you would want to go get a more formal assessment. And there are trauma psychologists whose expertise is in figuring out, is this PTSD or is it a different kind of stress disorder? And if it is PTSD, there are very specific types of treatment that can help. And the wonderful thing about PTSD is that it is treatable if you were following the evidence-based protocols, right? The evidence-based treatments that are available. So as with any kind of treatment, right, there's good treatments and bad treatments out there, and that it goes for mental health as well. So again, I bring up PTSD in the sense that there can be other types of traumatic events not related to your HHT, right? Having HHT doesn't necessarily protect you from all other life circumstances that can cause depression, anxiety, and PTSD and other types of mental health conditions. But it certainly could be a driving force, especially if you had one of those major medical events. And so that's why working with a healthcare provider or a psychologist who knows about trauma and knows about chronic medical conditions can be helpful, right? So imagine if you had this event where you had shortness of breath and you almost died. Now every time you have shortness of breath as one of your symptoms, you may be more reactive to it, and it may actually make your shortness of breath even worse. So working with a psychologist can help reduce that reactivity.
Great. So an individual is asking if a psychologist can prescribe medication or just utilize the types of non-medical options that you talked about, and if you did need medication, would you need to see a different type of provider?
Excellent question. There are medications such as antidepressant medications that have been investigated in HHT and other types of chronic health conditions. In general, they tend to be not as effective as comprehensive mental health care, like going through an evidence-based protocol, or having a combination of medication and psychotherapy is helpful. A psychologist is not, in most states, trained or legally able to prescribe medication. So that would probably be a psychiatrist. A psychiatrist is a person who went through medical school and specialized in psychiatry. So they're the ones who can prescribe medications, including mental health medications. A psychologist works on more of the behaviors, which can be just as effective and sometimes even more effective for managing these conditions, especially if you yourself are already taking a lot of medications. Sometimes the interaction of bringing in a new medication may or may not be of interest to you. So it's a great question for your doctor about whether to explore whether an antidepressant medication could be helpful, but certainly a psychologist could be helpful with that as well. And there are a couple states where psychologists are able to prescribe, but yeah, sorry, go ahead.
No, that's okay. And so is it important to see a psychologist that is familiar with HHT, or any particular background or experience you would recommend someone reach out to if they're looking for a mental health provider?
Great question. Finding a good fit for a mental health provider in many ways is kind of like dating, right? You want to find a person who has the right expertise, but also is the right fit personality-wise for you, right? So I am not everyone's cup of tea when it comes to treatment, even though I might have expertise in various conditions. So a good place to start would be to find a rehab psychologist or a health psychologist who works with people with chronic health conditions, right? There's a lot of similar features of various chronic health conditions, particularly ones that are genetic, right? Now, if you can find a psychologist who's connected to an HHT center, that would be a really great place to start. And most HHT centers probably have a recommended referral to a psychologist or another mental health provider. So you can start by calling your insurance company, seeing which providers are covered in your area, and seeing if they specialize in health psychology or rehabilitation psychology. And again, because HHT is so rare, finding a psychologist who specializes in HHT is probably going to be exceedingly difficult. Dr. Sarah Palmer being, the expert, right, and one of the best. So it can be a challenge, and it doesn't mean you can't still benefit from a provider, even if they're not, quote, the expert in HHT. My job as a provider is to learn about conditions that I don't know about, right? So if I see a new patient who has a very rare condition, and we see this at Johns Hopkins pretty frequently, I'm going to educate myself about that, understand how those factors may impact that individual, and then ask, right? In that first meeting, it's like a first date, right? Seeing if this relationship works.
Fantastic. And this will be our last question for the evening. Are there any mental health apps that you would recommend that might help track the SMART goals you spoke about, how you feel, just to kind of have that benchmark to determine if you really do need to seek professional attention or not?
Great question. And for now, especially, there are a million apps out there. The question I have is, make sure you look at how expensive it is, right? If this is something that's going to break your bank, there's no amount of help that it's going to do that is going to be worth breaking the bank. There are some free options right now, especially during the COVID pandemic, where you can get a free monthly subscription and try it out. And that's what I recommend people do, is try the interface, right? It's not just about whether the app, most of the apps essentially do the same thing. It provides a tracking system so that you can monitor symptoms. There might be an assessment component to it. There might be some relaxation strategies that you can practice with it as well. And it's that accountability piece. But they all look so different that it's in many ways a personal preference. So I have no affiliation with any particular app, but I do know things like the Calm app has a free option right now that you can try and see if those kind of calming or relaxation activities are helpful for you. There's also things like 24/7 mood that, again, whether an app or a website, that you can track your mood through that as well.
Great, thank you so much. And we really appreciate your time tonight. We have gotten many thank yous for the informative information in our chats, and we definitely appreciate all the information that you shared with us. And on behalf of everyone at Cure HHT, I want to thank you for attending tonight's webinar and for staying connected with us. We're always in this together, and we want you to know that we are here for you, the entire HHT community of patients, families, healthcare providers, and researchers, and that you can rely on us to provide the most current resources. We have a shared goal to give those affected by HHT a chance for a normal life. And this webinar is just one of many ways we accomplish our mission. We're grateful to the donors of Cure HHT for making this and all webinars possible. Please consider donating to Cure HHT to ensure we continue to offer high-quality education for you and your families. And after the webinar, please complete the survey so that we can better serve you in the future. And again, we want to remind you that all previously recorded webinars can be found online in the Cure HHT Resource Library. We have several educational events planned for June Awareness Month, including a new town hall meeting series with our Cure HHT Board of Directors. So please watch your email and social media for a complete list of activities and for registration announcements. Again, I want to thank Dr. Abbey Hughes for volunteering her time tonight. We really, truly appreciate your participation and hope that you enjoy the rest of your evening. Good night.
Good night. Thank you all.